Spotlight.
This is Akashvani. In the program Spotlight, now we bring you a discussion on role of Jan Aushadhi Kendras in providing quality medicines at affordable price. The participants are Ravi Dadich, Chief Executive Officer, Pharmaceuticals and Medical Devices Bureau of India, PMBI, and Arjun J. Chaudhary, Anchor.
So on the occasion of Jan Aushadhi Divas, we are proud to be joined by Shri Ravi Dadich ji, who is the CEO of PMBI, which is the Pharmaceuticals and the Medical Devices Bureau of India. And from Ravi Dadich ji, we'll try and understand the benefits of Jan Aushadhi. How is it that the average citizen of India across the 36 union territories and states can get access to cheap, reliable, qualitative and efficacious medicines and medical devices over the counter, OTC, and ensure that their out-of-pocket expenses are reduced, while at the same time ensuring that healthcare benefits reach all. So it's very good to have you on the program, and thank you so much. So let's try and understand what Jan Aushadhi is for the benefit of our listeners. What is Jan Aushadhi? How is it that it's qualitative?
Jan Aushadhi Pariyojana is a network of more than 15,000 Jan Aushadhi Kendras, which are retail medicine outlets, or generally as we know them as chemists. So under this scheme, these 15,000 Jan Aushadhi Kendras have been opened in all districts of the country, and they provide more than 29 therapeutic groups related medicines which we everyday use, which are prescribed by doctors for different diseases. There are more than 2,000 types of medicines which are part of product basket of Jan Aushadhi system, and there are 300 surgical items. Besides that, there are nutraceuticals and smaller devices like thermometer, glucometer or BP monitor, etc. So all these medicines or surgicals or nutraceuticals or similar items can be purchased by any citizen just by visiting these Jan Aushadhi Kendras, which are located all around, and at a price which is 50 to 80% lesser than the branded products. So when people have to take medicines on regular basis for chronic diseases or for serious other diseases or for even smaller acute like some fever or antibiotics, they can save a lot of money. So in this manner, this initiative of the government is a noble initiative which provides medicines to more than 1 million people who visit these shops every day, and these are available in your neighborhood.
Let's now hear what the Prime Minister of India, Shri Narendra Modi, had to say on the occasion of Jan Aushadhi Divas from Silvassa, which is the capital of the Dadra and Nagar Haveli Union Territory of India.
जन औषधि यानी सस्ते इलाज की गारंटी। जन औषधि का मंत्र है दाम कम, दवाई में दम। हमारी सरकार अच्छे अस्पताल भी बनवा रही है, आयुष्मान योजना के तहत मुफ्त इलाज की सुविधा भी दे रही है और जन औषधि केंद्रों के जरिए सस्ती दवाएं भी दे रही है। हम सब ने अपने जीवन में देखा है, अस्पताल में इलाज के बाद भी लंबे समय तक दवाओं के खर्च का बोझ रहता है। ये बोझ कम हो, इसके लिए देश भर में 15,000 से ज्यादा जन औषधि केंद्रों पर 80% तक कम कीमत पर लोगों को दवाइयां मिल रही है।
दाम भी कम और दवा में दम. Let's now hear from the Health and Family Welfare Minister, Shri J.P. Nadda, on the occasion of Jan Aushadhi Divas.
2027 तक प्रधानमंत्री मोदी जी के नेतृत्व में 25,000 जन औषधि केंद्र खोलने का लक्ष्य रखा गया है, जिसे और अधिक लोग सस्ती और अच्छी दवाओं का लाभ उठा सके। हर साल 7 मार्च को जन औषधि केंद्र के रूप में ये दिवस मनाया जाता है। इस वर्ष भी लगभग 5,000 नए जन औषधि केंद्र खोले जाएंगे। मैं सभी से अपील करता हूं कि नजदीकी जन औषधि केंद्र पर जाएं, दवाएं लें और उनकी गुणवत्ता और किफायती कीमतों को खुद अनुभव करें।
So to understand this slightly better, we're talking about generic medicines, allopathic, and to some extent Ayurvedic as well when we talk about medicines and medical devices which no longer enjoy patent protection. They are now in the generic category and they're available over the counter, but yet at the same time competing with branded counterparts.
Jan Aushadhi medicines are generally generic category medicines. Patented medicines are for very, very specific diseases and are required in very less quantity throughout the country. Most of the medicines are available in generic category as we generally use. So there is a huge product basket, as I mentioned, more than 2000 medicines, which covers the entire spectrum of all therapeutic groups, covering from ophthalmology or cardiovascular or central nervous system or all kind of medicines or anti-infective medicines.
Clearly, there is a huge disease epidemic when it comes to diabetes, cardiovascular, as you mentioned earlier as well. And these kind of diseases related to obesity and health is something that one can take advantage of under this policy of the government on health and family welfare.
Obviously, these are chronic diseases in which the patients have to take a medication on a long-term basis and on regular basis. So if they buy the branded products or other products, they have to spend a lot of money. Whereas the same products with the same quality under Jan Aushadhi system, they can purchase these medicines at a very affordable prices. So there is a protocol for procurement of these medicines. These are procured only from WHO GMP certified manufacturers. And not only this, once we receive these medicines in our warehouses, we anonymize the details, we hide the details and send them for retesting in 11 different laboratories which are NABL accredited. So on the standards of, say, its composition or assay, as they call it in the language of medicine word, or the dissolution, means how much percentage of this medicine will dissolve in how much time. So these are some of the parameters for ensuring good quality of medicines.
Ravi Daditji, apart from our listeners who are also customers at retail outlets at the Jan Aushadhi Kendras, how have you sensitized the NMC and the DCI, the Dental Council of India, and doctors and practitioners about the importance of prescribing medicine which can be procured from the Jan Aushadhi Kendra? Because usually the patient relies on the professional expertise of the doctor, they rely upon them, and the decision is usually, most cases, dependent upon what they say.
We have been communicating with the NMC, we have been communicating with state government officials of health ministry by bringing to their notice as well that Jan Aushadhi system works on these principles. It has a foolproof system of procurement and testing at each level. So there should not be any hitch in recommending these medicines. And we have been interacting with the renowned doctors in the country who have given messages on social media and in other modes that these medicines, they have been using it themselves. So when we get to hear this from any doctor's side who are renowned in their own field, other doctors will also accept that opinion about Jan Aushadhi medicines, and will obviously, their interest is also to help the patients not only by giving them treatment but by reducing the cost of their treatment, which is very essential given the vast size of our country and means people having less resources for meeting out the exigencies of any medical expenditure.
Let's also hear from the beneficiaries of the Jan Aushadhi Kendras, how it's touched upon their lives on a day-to-day basis.
My name is Brij Mohan Agarwal. I reside in IP Extension, Vandana apartment. For the last 15 years, I am suffering from diabetes and hypertension. Previously, I was taking branded medicine that were costing me around 5,000 rupees per month. But for the last 2.5 years, I am taking medicine from Pradhan Mantri Jan Aushadhi Kendra, and the total amount of my purchase is only 1,000 rupees. Every month, I am saving 3,500 to 4,000 rupees on my medicine. And these medicines are of very good quality because time to time I check my blood glucose level and hypertension with the BP blood monitor. That also I got it from Pradhan Mantri Jan Aushadhi Kendra, both the equipments.
So all part of medical ethics once again. What about if someone is interested in being a private operator for a Jan Aushadhi Kendra? What does this person have to do? What are the qualifications required in terms of the premises, in terms of staffing, in terms of the licensing requirements?
Jan Aushadhi Kendras can be opened by any individual. There is a very simple process. You have to visit our website, which is janaushadhi.gov.in. There is a column apply for Kendra. The requirements are that a person should be either himself a B Pharma or a D Pharma, or he can engage some person who has these qualifications and registered with State Pharmacy Council. Once they apply on the portal for opening a Jan Aushadhi Kendra at any place, we give them initial approval. Based on that initial approval, they apply for the drug license from the respective state government. Once this drug license is received by them, for which the requirement is a 120 square feet shop or a premises where the shop can work. That is the main requirement for the license of a drug store. So once they get that drug license, we connect with them through our SAP based ERP system and start supplying medicines which are procured in a centralized manner. So this being a closed loop, we supply medicines to these kendras in a very, very safe environment while maintaining the temperature and other requirements of the medicines as prescribed for each medicine. So a person can easily apply and open. We have a system of incentives for some categories which are like women, SC, STs or Divyang or ex-servicemen, and also some geographical areas like aspirational districts or Himalayan districts or island districts. They get one-time grant of rupees 2 lakh for meeting out the infrastructure related expenditure for establishing a shop. So for these categories or for people belonging to these geographical areas, they get extra support from the government for establishing a Jan Aushadhi Kendra. For others, there is a system of incentives. When the shop is opened, they get incentive up to rupees 20,000 per month for purchase base as well as for maintaining some minimum stock. So this entire system ensures that these shops are opened easily and at a very fast pace as envisaged by the government to increase the number of these kendras. Besides that, there is a app also which is called Jan Aushadhi Sugam app which people can download, and it gives you not only the location of your nearby Jan Aushadhi Kendra but also a comparison of Jan Aushadhi medicines and branded medicines prices. So customer can make a informed decision about the difference in price and then avail the services of this.
What kind of turnover are we looking at this figuratively because of 15,000 plus Jan Aushadhi Kendras which are owned and operated by private individuals and entities, while at the same time you are supplying essential medicines to them at very affordable prices?
Even at these affordable prices, we have a target of 2,000 crore worth of medicines at MRP value for this financial year. We have already crossed around 1,800 crore. So we are likely to get the target within the remaining part of this financial year. And it's almost a 30% growth from the previous year. So there is a great interest in citizens for availing the benefits of Jan Aushadhi Kendra. By purchasing medicines under this system in last 10 years, people have saved more than 30,000 crore rupees. So it's a direct saving to the customers.
So I understand that the target of the Jan Aushadhi Kendra as a retail outlet is to the customer, to the average citizen of India who has healthcare needs for himself, for herself and their family as well. Could you tell us how it is linked to the Ayushman scheme where you are seeking treatment from doctors and practitioners and of course all the testing that's carried out?
Ayushman scheme is for indoor patients mainly, and as of now there is very little connect with that. But any patient availing any benefit under Ayushman scheme, as a citizen he can visit Jan Aushadhi Kendra to reduce the expenditure on medicines, because following any indoor operation or indoor activity in hospital for any patient, he will obviously need some medication for some time. So these people can simply visit to any Jan Aushadhi Kendra in their vicinity and buy these medicines off the shelf at any point of time for saving more money.
It's time for us to thank Ravi Dadit ji for being with us on Akashvani and explaining to us the benefits of the Jan Aushadhi Kendra and appeals to our listeners to go and visit a Jan Aushadhi Kendra and avail the benefits in terms of quality, in terms of price and access to a better healthcare so that their out-of-pocket expenses can be reduced and they can have a higher standard of living. Thank you so much, sir, for being with us on Akashvani.
Thank you very much.
You were listening to a discussion on role of Jan Aushadhi Kendras in providing quality medicines at affordable price. The participants were Ravi Dadit, Chief Executive Officer, Pharmaceuticals and Medicals Devices Bureau of India, PMBI, and Arjun J. Chaudhary, Anchor. This program program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsttalks@gmail.com or WhatsApp on 9289094044.
Spotlight.